Hello all, I am really sorry that I haven't put up a video up in ages. I've been really busy with university, moving house, with my partner, got engaged, yay! And all sorts of stuff, so I'm really sorry I've been really lazy with that. I said that I would talk about appointments, having to attend when you're young, and the appointments I have to attend now. There's not really a lot of appointments you have to attend when you're older, unless you're having problems with your neurofibromatosis, such as any fast, rapid growth of any tumours or anything like that. You should really have someone check your blood pressure regularly, monthly maybe, if that. It's just because people with neurofibromatosis can have quite a high blood pressure, and there's that risk of hypertension, and especially in pregnancy there's like preeclampsia, so you want to make sure that your blood pressure is at a good level, and that you're having it checked regularly. Appointments that I went to when I was young, I went to several appointments that I can remember. I went to a few initial appointments to confirm my diagnosis. I went to appointments to assess whether I had a learning disability or not. I seem to remember going to them quite regularly, just to check that my development was on track, so things of like memory, I guess that comes under cognitive, physical, and things like that. And at school I had someone who helped me with my hand-eye coordination, because neurofibromatosis, you can have a bit of a problem with that. And I had extra help at school, things like that, so I went to like touch typing lessons because my handwriting was appalling, and I went to kind of like lessons where I had to catch balls, throw them against the wall and catch them, and all sorts of stuff like that. I also had to go to appointments for my spine because I have sclerosis of the spine, so my spine is slightly curved. So I went to appointments about that, and that was fairly simple. I think I went to like a chiropractor about my back, because I had quite bad back pain. But other than that, I didn't really go to that many appointments because my neurofibromatosis wasn't too severe, which I was very lucky with. Appointments that you can go to, I suppose, when you're older, depending on the severity of your neurofibromatosis. Go to a doctor for regular checkups on your neurofibromas. So if you notice them getting bigger, or you notice a sudden mass increase of them, they change colour, shape, size, or they become itchy and sore, you really should go to the doctor and have them checked out. It's quite a small percentage of them turning cancerous, but it is worth being sure. I went to doctor about one on my head. It was a hard lump, so I believe they're called plexiformas. I went to the doctor about that because I had one just there, and then within the space of about a year, 2 years, I had about 4 more, and they were sore, and if you caught them they were really painful. I was catching my brush on them, so I went to the doctor about those. That was last year, and they took one of them out, and I was warned by my neurofibromatosis specialist doctor that I see that there is a chance they can grow back quite soon after, because you're causing trauma to the skin and the nerve endings, and apparently they can grow back quite quickly. As well as, because it's a hard lump, not all of it can be removed sometimes, so if it's not all removed it will grow back, which happened to be the case. Unfortunately, about a week after the surgery, it grew back. Same size, seemed to grow back pretty instantly actually, just as painful. So if you're thinking of having one of your hard lumps removed, I personally, unless it's huge and it's causing a real disturbance to you, I really wouldn't recommend it. If it's just there and it's a small hindrance, I wouldn't recommend removing it, because it's, a chance it could grow back, and it's really not worth it at the end of the day, going through minor surgery for nothing if it's just going to grow back. Okay, so I'm going to also talk about a few things that are important throughout pregnancy, although I'm not at the stage yet when I'm going to be having children, but I thought I would talk about the things that I've experienced and started to think about with pregnancy. So I've got leaflets here and whatnot, and if anyone wants a copy of the leaflets, let me know, and I will photocopy and email them to, I'll scan them in and email them to you, but just drop me an email and let me know that you would like them. Okay, so initially what I had to do before I saw an NHS NF specialist about my neurofibromatosis and pregnancy, questions I wanted to ask, and I had to have a blood test first, a genetical blood test, to confirm my diagnosis of neurofibromatosis. I don't know if they do it to children now, if they suspect neurofibromatosis, but I certainly didn't have it when I was a child. Mine was spontaneous mutation, so neither of my parents have it, nor do anyone in my family have it. So yeah, I had to have a blood test first to confirm my diagnosis, as I said, and they wrote to me saying, yep, you have neurofibromatosis and whatnot. I spoke to a neurofibromatosis specialist about the diagnosis and chance of passing it on to children. I don't know if anyone who's watching this will know this. There's a 50% chance of passing it on to your children. There's no way to confirm how severe the condition will turn out to be. Sorry, tea. So you could have a child who, if you have a very minor form of neurofibromatosis, who may have neurofibromatosis but very, very low on the spectrum, like myself, so you may not even really notice the neurofibromatosis other than a few cafe lays and whatnot. Or it could be the other end of the spectrum. You could have a child who's quite severely learning disabilities, and who's got quite a lot of tumours and who's quite severely affected by it. There's no way to tell. It's quite a tricky decision to come decide whether you want to have children or not if you have a diagnosis of neurofibromatosis, because of course there is that risk of passing it on. Although it's only 50%, it's still half and half, so there's still that, of course, risk there. Like I said before, there's no way to tell how severe or how the condition's going to affect your child until they're born, and unfortunately it's just play it by ear and play out. But there are tests you can do whilst you're pregnant to find out if your child had neurofibromatosis or not, and depending on that you can decide whether you want to continue with the pregnancy or not. So first of all, I'm going to look at chronic villus sampling test. So that's there, in case I've pronounced it wrong. So what this does is it takes a bit of the amniotic fluid and it looks at that, and that can tell whether it has neurofibromatosis or not. I'm just going to read out the information here because I don't know it that well. So it says that no test is absolutely perfect, but the CVS test is very reliable, which is a chronic villus test. It fails to give a clear result in less than 1 in 100 cases. So people can have it for any other chromosome reasons, and neurofibromatosis being one of those chromosomal reasons. You can have that done. Some people have it for non-chromosomal reasons, but I wouldn't know much about that, I'm afraid. So when is it performed? This test is performed from the 11th week of pregnancy until the end of the 13th week. However, it can be performed after this in urgent cases. So it's performed during that time period. How is it performed? Before test is done, ultrasound scan is carried out to check the date and the position of both the baby and the placenta. So there are 2 ways of doing the test. The doctor doing the test chooses the method that he or she thinks is the most appropriate for this, and it depends on the position of the placenta. First of all, they'll do it through the abdomen, which is called transabdominal. It sounds scary, but it's not, don't worry about it. So the skin over the womb is cleaned with antiseptic and local anaesthetic, and is given to numb the area. A very fine needle is passed through the wall of the womb into the chorionic tissue. Sorry, not chorionic. Ultrasound is used to help the doctor guide the needle into the right place. A small sample of the chorionic tissue is removed through the needle and sent to the laboratory. So there's a picture of it just there. Okay. So, and the other one is transcervical, and that's up through the vagina, through the neck of the womb, past the cervix. So the vagina is cleaned with antiseptic wipe, and a pair of forceps is then passed through the cervix. This can feel like having a smear test. An ultrasound is used to help doctor guide the forceps in the right place. A small sample of the tissue is removed and sent to the laboratory for testing. With both methods, only a small amount of the placenta is moved, and about the size of a few grains of rice. So, of course, it can be quite uncomfortable. If any of you have ever had something like a coil fitted, I assume it feels something like that, because they're passing something past the cervix. It's that same kind of period crampy pain, having that done, I would assume. If you have a test done through the abdomen, you can have like a pushing feeling and a little bit of soreness. There is a risk, as with everything, so there is a chance of miscarriage with this. I don't know the exact facts and figures, I have to look that up for you, because you're going into the womb and you're prodding around, so anything like that's going to cause a risk. So here we go. It's available, so it's been available for quite a while, so they're quite used to doing them. Scientific literature experiences to indicate that 1 to 2% will actually miscarry as a result of the procedure. So it's pretty low. So it's taking a little bit of the placenta, not the amniotic fluid, I'm afraid. That's the next test that you can have done. So if anyone would like a copy of this is called the chronic chorionic villus sampling test. Next one we're going to look at is the one that I got a bit mixed up, is the amniocentesis. So what that is it's similar with the chronic villus test. So I'm just going to show you a picture of what they're going to do. Okay, let's have a look. So it's quite a reliable test, and it's quite commonly done. Every year in Britain, over 15,000 women have tests performed. So they've done it for a while. They're quite accurate. And 1 in every 200 women, which is 0.5%, will miscarry as a result of that. So it's a lot safer, not 0.5% safer than the chronic chorionic villus test. Okay, so how is the test performed? The test involves a small amount of amniotic fluid, which is the water surrounding baby, to be taken from the womb. This contains cells from the baby, and they are tested in the laboratory. Before the test is performed, an ultrasound scan is carried out to check the age and the weeks of the baby, and the position of the baby and the placenta. The skin of the womb is cleaned, an antiseptic solution and a fine needle is passed into the womb, taking a sample of the fluid. So they don't numb you for this, which, I don't know, that sounds kind of more uncomfortable to be honest, but the position of the baby and needle are monitored through the ultrasound scan. Very occasionally, the doctor is unable to get the fluid at the first attempt. You may need to reinsert the needle. Most women say that afterwards the test, they feel a bit uncomfortable rather than pain, but it feels similar to period pain. Generally, women say that the thought of it is worse than the actual test. I think the thought of someone sticking a needle into my stomach is worse. It probably sounds worse than actually having it done. So it says you'll probably be at the hospital for about 45 minutes, but a test itself only takes a few minutes. We encourage you to bring a companion with you to support you. And it's a good idea to take things easy for a couple of days, and the period type pain will relieve itself after 24 to 48 hours. This is not unusual, and it will settle with paracetamol. And if you're, so what they'll do is they'll contact you with the results. They usually take about 2 weeks. You'll be contacted by telephone as soon as results come through and given the opportunity to discuss the findings. So I guess they'll call you, and if there's something abnormal, they'll get you to come in and they'll chat with you, and if it's not, then they'll just say, yeah, everything's fine. And if you want a copy of this is the amniocentesis test. I can send you a copy of that. Both sound frightening at first, and of course it's going to be something scary to go through, especially if you're having it done to check for a chromosomal condition and whatnot. But they do advise that you go to a genetics counsellor prior to getting pregnant if you can. Of course, not everything is that well planned out. You can't always plan when you're going to have a baby. If you're planning for a child and you've got neurofibromatosis and you know that there's that chance of passing it on, I would really recommend going to a doctor and asking for an appointment to see a genetics counsellor. They will just talk through the risks, problems and any potential risks, I guess, and to talk about the risk of transmitting the condition to your child if you do not know it yet. If you haven't had your genetic blood test, they may want to do that there. And they may want to check your partner, possibly, if your partner has a query over neurofibromatosis or something like that. So thank you again for watching my videos. I really appreciate you guys tuning in. If you have any questions at all about anything I've talked about, or you want a copy of any of the leaflets, please do ask. If you want to just have a chit chat, lovely, no problem. I'll pop my email address in the comments description box. Any questions, please email me. Like before, I have disabled the comments just because people will probably put something inappropriate, and ignorant people will probably say something that will upset maybe some people, and it's just not worth it. Anyway, I hope you all have a lovely Christmas, because I'll probably post something after Christmas next. Take care. Bye.